Hi everyone, welcome back. So this is another one of my gains without pains videos where I talk about how to reduce the risk of injury with common exercises done in the gym. As I've said, if you will have seen if you watch my previous video on this, my job as a sports therapist is not just about, treating injuries and giving a good massage. It's actually also about teaching how to prevent injuries, which will obviously limit your performance in the gym. How to do this basically through correct technique and, maintaining good posture, so that the client, is then able to continue to reach their goals, to become fitter and stronger, which presumably is why you're in the gym in the first place, and at the end of the day to prevent or hopefully reduce at least the risk of injury in the gym. So this gains without pains series of posts takes a look at common exercises done in the gym, looking at the correct posture and correct technique in order to reduce this risk of injury. So in this video today, it's going to be a short one, but I'm just going to look at three of the cardio-based types of exercise done in the gym. So I'm going to be looking at exercise bikes, rowers and treadmills. And we'll just look at sort of common mistakes that people make and how to really just, improve your technique. So the first one that I'm going to talk about is the good old exercise bike. Now, benefits of the exercise bike, it provides a great cardio workout while also working the lower body, and it can also help strengthen the back muscles and the arms. But people, it sounds easy, just sit on a exercise bike and pedal away, but people do make some mistakes when using these bikes. So common mistake, is with positioning. Bad positioning is always going to mean that certain muscles, are taking the impact that shouldn't be. So, by setting the seat to hip height when standing beside the bike, that's, what you need to be looking at here. Ensuring the leg, when your pedal is at the lowest point, you want to ensure that the leg is stretched, but with a slight bend to the knee. And this will help to prevent straining your hip, straining your thigh, and also your knee. So you just want a slight bend there still. Also, you want to ensure that you're, as even if you were, riding a bike regularly, sort of at home outside of the gym, you want to ensure that you are keeping your toes pointing forwards, because if they turn inwards or even point outwards, what happens is you actually alter the angle at which the IT band crosses the knee joint. And I have done a video on IT band syndrome and lateral knee pain, which talks about this in more detail. So do go and watch that video. So by affecting the angle of the IT band, that again can cause inflammation and irritation around the knee joints. It can cause strain of the hips, strain of the knees. So do ensure that the feet are kept pointing forwards. Also, the handlebar, it should be a couple of inches lower than the saddle. And quite often, people will have it at the same height or even a little bit higher. But no, just keeping it a couple of inches lower helps you maintain good posture throughout the exercise. And that way the arms are fully extended, and this will avoid lower backache. So good technique on an exercise bike. Basically, as we've just talked about, keep the back straight to prevent any upper body issues. Ensure that handlebar is lower so that you're keeping the arms fully extended to avoid lower backache, and just keeping the feet in a forward-facing position, to avoid strain on the hips and the knee, through that IT band. So pretty simple. So the next one we're going to talk about is the treadmill. Now, benefits, running on a treadmill involves less stress on the joints, and also the pace can be controlled. So, but, people do still make a few sort of little mistakes, which can obviously, again, increase the chance of injury. So by holding the handrails, actually this can cause a hunched posture, which obviously can then sort of strain the back and across the shoulders. And to be honest, if you feel the need to hold on to the rails, then the likelihood is either your speed is too high or the incline is too high. So just, reduce those down a bit and don't hold on. Good technique. If you exceed an 8% incline, what that does is actually it puts a strain on the back and the hips and the ankles. So just try to sort of keep it below that. If you want to work harder, then just maybe go a little bit faster. And the next thing I'm going to say here is going to sound really stupid, and people are going to think, well, like, obviously you would do that. But actually, this is one of the most common injuries or causes of injury in the gym. Wait for the treadmill to stop before getting off. Sounds basic, but yes, people are that stupid. And this is one of the most common causes, as I say, of injuries in the gym. So it's pretty common sense, but some people don't. So again, pretty straightforward. There's nothing too complicated. Common sense things, to just improve your technique on the treadmill. Okay, and then so finally, the last one of these cardio machines that we're going to talk about today is the rowing machine. So, obviously, the benefits of using a rower are, it's a low impact exercise, but it still uses all of the muscles, and you can really burn a lot of calories by doing this. Again, there are mistakes that people make. The most common one being that people use only really the arms to row, which actually places a lot of stress on the back and the shoulders. Whereas if you use, the whole body, and really use your legs to kind of push your way through the movement, that will take a lot of the strain off the back and reduce the chance of injury. So good technique. Again, it's pretty basic, but as we said, using only the arms, it's kind of defeating the point of sort of doing this exercise and working all those muscles. You're not gonna get that benefit. So you want to be really pushing with the legs probably about 60% of the time. And then, the remaining 40% of the effort coming through the core muscles and the arms. You should be doing, long, controlled strokes, not rounding the back. You want to engage those, the core muscles, those abdominal muscles, keep those nice and tight. And just pull the shoulders back and down. We don't want a hunched posture because again, that's going to strain the back. And then really just check the resistance. You want to have it at a level where it's challenging for you, but also that it's comfortable, because if you're immediately feeling any kind of strain, then you need to just reduce that resistance a bit. It's kind of rather like with the kettlebells, if you start out on too heavy a weight, again, the exercise isn't really going to be very efficient. All you're going to do is increase the chance of injury. So work your way up gradually and keep at a level that is comfortable for you. So that's a very short video, but that is a basic run through of common mistakes that people make when using these cardio machines in the gym. There are going to be others of these gains without pains videos coming up, so do subscribe. You'll be notified when they come out. Feel free to comment down below, or contact me through Facebook or Instagram. As I say, I'm not a personal trainer. The information I've given here is based on my work as a sports therapist and my knowledge of physiology and anatomy and how the muscles work within these exercises, and sort of what muscles and joints take the impact of these exercises. So, if you are starting out at the gym or you're coming back following an injury, do talk to a personal trainer as well to get their advice on these exercises. So the next video that I am actually going to be doing will be talking about squats. So as I say, do keep your eye out for that one. But until then, that's all from me. So take care, and I'll see you next time. Bye.